This is a short introduction to student assessment using ongoing achievement record for Year 1 students. When students go into their placements, there is a period of time for settling in and a period of time for assessment. Students are supervised by a mentor who is a nurse who's completed a specific program in assessing students and is responsible for their supervision and their assessment in practice. Students should gradually move towards a point of practicing a level of proficiency, competency and accuracy under their mentor supervision. As first years, you'll be directly supervised for the majority of your time. The Nursing and Midwifery Council require 40% of your placement to be accessible to a mentor. And your named mentor is responsible and accountable for planning and coordinating the whole learning experience, determining what direct supervision and what experience may be gained through indirect supervision, and that's working with others. Other members of staff and other professions may be supervising you as first years. However, they feed in to your assessment process. So, ongoing achievement record are called OARS. The purpose of this is to enable you to demonstrate you meet the Nursing Midwifery Council progression points and standards. During the 3 years, you will work in a variety of practice placements, ensuring the breadth of experience required to meet those standards. It's an NMC mandatory requirement that you progress, and your assessment record is made available to your mentor in each placement. It is your responsibility to ensure it's completed at the end of each placement. Your assessment is based on the NMC domains, which are professional values, communication and interpersonal skills, nursing practice and decision making, leadership and management and team working. Each year has a set of descriptors to reflect an increase in the competence proficiency for the stage of the programme. So before each placement, you're required to undertake preparatory work. You're going to be going on a placement visit, and you can start some of that work there, looking at common patient conditions, looking at the pathophysiology related to these conditions, what key elements of nursing care are related to managing the patients in this patient area, what assessment tools do they commonly use, what are common medications and treatments used in the placement, what action needs to be taken if I wish to escalate concerns or report incidences. So while you're in placement, we expect you to have undertaken some of the preparatory work before you start, to be working 40% of your time under direct or indirect supervision by your mentor. Work shifts with the rest of the nursing team, so if it is a 24-hour service, 7 days a week, then you need to experience the service. We would not normally expect you to work more than 75 hours per fortnight, which is equivalent to 37.5 hours a week, which is not over the European Working Time Directive. We expect you to be there for handover meetings at the shift changeover, and we expect you normally wouldn't work more than 2 weekends in any 4-week period for more than 14 night shifts during your programme. If these things are difficult, it is possible to negotiate between your mentor and seek advice from your personal tutor. You need to agree a development plan within the first week or second week of your placement, but don't leave it any longer than that. Look at the type of evidence that you can think of to put in for your domain. I'll talk about that more in a minute. And identify and complete wider patient activity. Agree a date for your formative, which is your halfway assessment, and then a date for your summative, your final assessment. You are to provide all for your mentor and show them any evidence that they require to see. And if you have any concerns or incidents, please speak to your placement development team lead or your personal tutor as soon as possible, and you will meet your placement development lead during your introduction to placement week. So what happens with assessment? You set up a development plan. This is with you and your mentor, and the mentor has to agree it, and they will signpost and to you to suggestions that will be relevant to your outcomes and also the placement area. This is an ongoing review document and can be updated as required. You're required to provide evidence. That's 3 forms of evidence for each domain. One must be direct observation, that you are directly observed undertaking care and skills, and also a reflection. And I'll talk about those in greater detail in a minute. Your reflection should be referenced. It should be around 750 words, and it should be related to one of the following. It can be related to direct observation. If somebody's directly observed you doing, let's say, a dressing technique, you could reflect on that, say how you felt you were prepared, what you felt you didn't know, what you've learned from the experience. That is a reflection. You could be asked questions. Some mentors will give you quizzes to do and ask you questions, and again you could reflect on that as well as providing evidence of the questioning or the quiz. You'll be working alongside other people, and they may well give statements on how they found you when working with you. You could reflect on this as well. What I learnt, what I need to develop. Simulation. You may experience some situations where a simulation is appropriate. Some of you may be in clinical practice and they're doing resuscitation simulations. And again, you can provide the evidence that you were participating and do the reflection. Or equally, for example, we had a first-year student with a health visitor, and there was some health promotion that needed to be considered, and how the student would give health promotion, and the health visitor set up that the student would give health promotion advice to one of the health visitor's colleagues who played the patient, and again you could reflect on how that went and how that's developed you. Products of your work, don't forget some of your academic work and your skills workbooks will all relate to products of your work, and again you can reflect on that. Engaging with a service user, getting a report from a service user or any wider patient activity you may do, again you can reflect on how that has developed you. Formative assessment of practice, approximately halfway. It is essential for you to know how you're doing. It enables you to undertake a self-assessment and then review where you are. You are not expected to be perfect at everything at formative stage. You're expected to be able to say, well, I'm doing well here, but I need to develop there. And this is what happens at the meeting with your mentor. From that, you can develop an action plan about what you need to take forward. Your summative final assessment needs to be at the end of your placement. You cannot be assessed unless you've done a minimum of 150 hours. But your mentor will guide you as to this timing. Your practice is graded. It allows you to work and develop towards a higher grade. Your mentor will indicate the level of achievement using a scale of 0 to 100%, and it reflects the skills that they see, the knowledge that you demonstrate, and also your professional values for the stage of your program, that is, as a first year. So you should demonstrate them in practice, but also with the evidence that you collate and provide for them. You have to get a minimum of 40% to pass. So let's have a look at the domains. Here's the professional values. These statements are indicative guidance to guide you and your mentors of some of the things that could be demonstrated to meet this domain. You do not have to address every single one. However, in your general practice, you could demonstrate every one. If you demonstrate some better than others, then that will be reflected in your grade. Here's communication interpersonal skills. Again, you should be able to demonstrate these within your placement. Nursing practice and decision making. Again, you may develop some of these areas better than others, and again that can be reflected within your grading. Again, management and leadership. So it would be expected that by the end of the year that you have demonstrated most of the guidance items within your placement, and your grade will reflect it, and also the action plan will reflect what you may need to do if you haven't done anything so well or been able to demonstrate it as well as you may want to. So let's have a look at the grading. The majority of you will sit in satisfactory and good and maybe very good. Here are the guidances that meet that. We ask mentors to choose one of the 3 or one of the 4 grades. If you look at the higher ones, it's about consistency, consistently being demonstrated, and that's the evidence base to underpin what you're doing. So your knowledge about what you're doing, how you're performing, the underpinning knowledge, and this will be demonstrated through your referenced reflections, and this is one of the key things that will demonstrate that underpinning understanding and knowledge. Your final assessment, your summative assessment, is a planned meeting. You and your mentor will develop to decide what you have successfully achieved and decide on the performance. You must achieve all domains to some degree or another. You will have a hand-in date for your assessment documents to be handed into program admin. If you don't provide sufficient appropriate evidence, or you have been assessed as not competent, you will not pass, and you will be reassessed following decision by the award board. So, if you're given a score of less than 40% for any domain, an action plan needs to be set up, ready for your next placement. You will discuss this with your personal tutor. When you go into your next placement, you can work on any of the referred domains and again be assessed in the next placement. When you resubmit, they will be capped at 40% because you are also need to know that you have to have only 2 attempts at practice. So if you don't succeed in the first placement, if you don't succeed in the second placement, then the exam board will consider discontinuing you from the course. So your final assessment looks like this: the domains, the evidence that the mentor has seen, and the grade the mentor gives you, 1 for each. You're to sign and confirm that your portfolio is up to date and everything is ready and presented to your mentor. You will either be passed or referred, and the percentage will be added there. Your personal tutor will see this and they will sign. Your mentor needs to sign, and this is just a record of your night duty. You are invited to provide comments, mentors' comments, and personal tutors' comments. If you need to take anything forward, then the action plan can be completed, ready for you to go into your next placement. So I'm going to remind you about referrals. Personal tutors are involved. If you are referred on any domains, you can be reassessed in the next placement. If it is the end of the year, then we usually put you into placement for a period of 150 hours for you to achieve what you didn't pass. If you are reassessed, it is a second and final attempt. I'm sorry, I'm going to go back. Reassess marks are capped at 40%, and if you're in the final placement, then the extra time is given, 150 hours, as I've outlined. The document will be explored in more detail during the preparation for practice. This is an aid memoir for you to use.